Conjunctivitis, or more commonly known,
Pink eye.
is an infection that affects the conjunctiva, the mucous membrane that surrounds the eye.
The bacteria that causes pink eye was discovered in 1883 by Robert Koch. However, it was not concluded that this bacteria in question was linked to pink eye until 1886 by John Elmer Weeks. When a person has conjunctivitis, the conjunctiva becomes red and swollen. When the mucus swells up, the usual clear fluid turns to a white and red color.
There are two types of conjunctivitis, viral and bacterial.
Conjunctivitis is most commonly contracted by
Virus and bacterial-induced infections,
dry eyes from lack of tears or exposure to wind and sun,
chemicals, fumes, or smoke,
and allergies. Pink eye is contagious and can spread very easily. Poor hand washing is usually the main cause of pink eye contraction. However, sharing items like cloths or towels can also be the cause.
More specifically, viral pink eye is often caused by an adenovirus, or the herpes virus.
Its symptoms include redness of the eye, swelling of the eyelids, itching or burning feeling of the eyelids, swollen and tender areas in front of the ears, a lot of tearing, and clear or slightly thick whitish drainage.
Medicines are not usually used to treat viral pink eye, as it simply needs to take its course. Symptoms usually last 5 to 7 days and then will go away. However, it has the risk of becoming chronic.
Bacterial pink eye usually occurs when bacteria enters the area surrounding the eye.
This bacteria could be in the form of staph infection, cat scratch disease, or gonorrhea.
Symptoms once contracting bacterial pink eye include redness of the white of the eye, gray or yellow drainage, mild pain, or swelling of the upper eyelid.
Unlike viral, bacterial pink eye can be treated with antibiotics, usually in the form of eye drops.
If this is done, symptoms usually only last 2 to 4 days. Without antibiotics, the pink eye can last 7 to 10 days. These symptoms should prompt patients to consult a doctor.
When consulting a doctor, he or she will usually examine the eye and even take secretion samples from the eye and send them for laboratory testing.
Given that children are most commonly those with weaker and developing immune systems, as well as the age group most susceptible to germ spread, the pink eye virus is greatly noticed within the first years of a child's life. People with allergies or people who use contact lenses are also at higher risks.
This being said, everyone is at risk for a contraction of pink eye, and it is in fact a very common disease since it is so easily passed on.
The best way to prevent your risk of the disease is to wash your hands, don't share eye cosmetics or towels, regularly change pillowcases, and most importantly, refrain from touching your eyes.